The integumentary system is the body's outer layer, composed of skin, nails, hair, glands, and nerves. It acts as a physical barrier, protecting the body from bacteria, infection, injury, and sunlight. It also helps regulate body temperature and allows us to feel skin sensations. The skin is the largest organ, covering about 1.5 to 2 square meters in adults. It includes glands, hair, and nails. The three main layers are the epidermis, the dermis, and the hypodermis, also known as the subcutaneous layer. The epidermis is the most superficial layer of the skin. It is composed of stratified keratinized squamous epithelium, which is thickest on the palms and soles of the feet. This layer lacks blood vessels and nerve endings, but receives oxygen and nutrients from the dermis. The epidermis has several strata of cells, extending from the deepest stratum basale to the most superficial stratum corneum. Surface cells are flat, dead, and filled with keratin. The epidermis is completely replaced in about a month. Melanin, a dark pigment, is secreted by melanocytes and protects the skin from harmful sunlight. Exposure to sunlight increases melanin synthesis. Langerhans cells, tissue macrophages, play a key role in immunity. The dermis lies beneath the epidermis and is tough and elastic. It's formed from connective tissue with collagen and elastic fibers. The rupture of elastic fibers leads to stretch marks, and the decline in collagen's water-binding ability causes wrinkles. Structures in the dermis include blood and lymph vessels, sensory nerve endings, sweat glands, hairs, erector pili muscles, and sebaceous glands. Arterioles form a fine network supplying structures within the dermis, and lymph vessels also form a network throughout this layer. The dermis contains sensory receptors sensitive to touch, temperature, pressure, and pain. These receptors allow the skin to function as an important sensory organ, providing information about the environment. Sweat glands are widely distributed, most numerous in the palms, soles, axillae, and groins. Their primary function is regulating body temperature. Excessive sweating can lead to dehydration and depletion of sodium chloride. There are two types of sweat glands. Eccrine sweat glands are the most common, opening onto the skin surface, producing watery fluid important for cooling. Apocrine sweat glands open into hair follicles, are found in the axilla and perineal areas, and are not significant for cooling in humans. Hairs are formed by downgrowth of epidermal cells into the dermis. Cells multiply in the papilla or bulb and keratinize as they are pushed upwards, forming the hair shaft and root. Erector pili are smooth muscle fibers attached to hair follicles. Contraction causes hair to stand erect, resulting in, quote, goose flesh. This helps trap air, acting as an insulating layer in response to fear or cold. Sebaceous glands secrete an oily substance called sebum into hair follicles. Sebum keeps hair soft, provides waterproofing, and acts as a bactericidal and fungicidal agent. Their activity increases at puberty. The hypodermis, or subcutaneous layer, is located between the skin and underlying structures. It is composed of areolar tissue and adipose, or fat tissue. Nails are hard, keratin plates derived from the epidermis, protecting the tips of fingers and toes. The nail plate grows from the nail bed, which is the germinative zone of the epidermis. One of the skin's functions is protection. The keratinized epithelium forms a waterproof layer, acting as a barrier against microorganisms, chemicals, physical agents, and dehydration. Langerhans cells, a type of macrophage, stimulate an immune response. Sensory nerve endings in the skin trigger reflex actions, such as withdrawal from unpleasant or painful stimuli, protecting the body from injury. Melanin pigment provides protection against harmful ultraviolet rays. The skin regulates body temperature, maintaining a constant temperature for optimal enzyme activity. A negative feedback system balances heat production and heat loss to the environment. Most heat loss occurs through the skin and is the only route that can be regulated. Heat loss is affected by the temperature difference between the body and environment, exposed surface area, and clothing. Mechanisms of heat loss include evaporation, where sweat turns to vapor, radiation, where exposed parts radiate heat, conduction, where objects in contact take up heat, and convection, where air passing over the body is heated and rises. The hypothalamus regulates body temperature. Decreasing temperature causes dermal arterioles to constrict and skeletal muscles to shiver, conserving heat. Conversely, rising temperature causes dilation of arterioles and sweating, increasing heat loss. When body temperature increases slightly, sweat glands secrete sweat. Evaporation cools the body. Insensible water and heat loss occur even when environmental temperature is low. Another function of the skin is the formation of vitamin D. Ultraviolet rays in sunlight convert a lipid substance in the skin, 7-dehydrocholesterol, into vitamin D, which is essential for bone formation and maintenance. Cutaneous sensation is possible due to sensory receptors in the dermis sensitive to touch, pressure, temperature, or pain. These stimuli are transmitted to the cerebral cortex. Areas like lips and fingertips have higher sensitivity. The skin has limited absorption property, allowing some drugs to be absorbed, such as those in transdermal patches for hormone replacement or nicotine. However, some toxic chemicals, like mercury, can also be absorbed. The skin is a minor excretory organ for substances including sodium chloride in sweat, urea when kidney function is impaired, and aromatic substances like garlic and other spices. Thank you for watching this video on the skin and integumentary system.